in, but we're super glad that you are all here. Amazing. Happy Tuesday. So great to see so many of you joining in. Um, the Healthy team here is based in New York City, so it looks gloomy, but we don't have any snow. But if you're somewhere where you got a bunch of snow, let us know. Tell us where you're at and if you and how much snow you got. I see New York, San Diego. No, no snow in San Diego, I'd imagine. Awesome. Great. Lots of snowy places. Well, let's get started, everyone, because we have so much to cover today. And I am really excited to introduce you to our partners at Keragon. I am Stephanie from Healthy. And what we're going to be covering today is digging in a little bit deeper into our partnership and integration with Keragon, which really just brings so much more to healthy users as far as automations and workflows go. I always bring it back to our principle of why we build out integrations and our partnership as part of our marketplace is because one tool cannot possibly do every single thing that you need, especially in healthcare, right? And if it even tries to, it doesn't do all of those things as well as you need it to. What you really need is for all of your tools to work together in a really streamlined and efficient way. And so that really is the foundation of our webinar today. We're going to go through, I'm going to turn it over in a minute to Panos from the Keragon team, who's going to tell you a little bit more about what Keragon is and how it works with Healthy. We're going to go through some workflow demos. So don't worry if you have not seen Keragon, if you have not built workflows, if you're not even sure what a workflow is, don't worry about it. We're going to cover all of that. We're going to make it really easy for you. We're going to show some common use cases, so integrations that plug in through Keragon and Healthy and how customers are using that. And of course, we have Christopher here from Harmonic Health, who is also a Keragon and Healthy user. And he's going to talk through some ways that he is using the integrations to power his operations in care. So you're really going to get a very good end-to-end look at how this partnership and integration tool can be used in your practice. We'll, of course, save time for Q&A. So, if you have any questions, feel free to drop it into the questions box or in the chat, and we'll get to them at the end. And of course, this will be recorded. So if you do need to drop, you can't stay for the whole thing. Don't worry about it. We will send out the recording to everyone afterwards. And with that, I'm going to turn it over to Panos. Thank you for being here.
Thank you so much, Stephanie, and hello, everyone. I'm Panos. I'm one of the co-founders at Keragon, and we are really excited to be here with all you today, and really honored to be the first partner featured in Healthy's new Hardware Connect series. So thank you so much for that. A super quick overview from our side. Keragon is an AI automation platform built specifically for healthcare. So if you're familiar with tools like Zapier, uh, we are HIPAA compliant version designed for the healthcare ecosystem. So Keragon enables powerful automation. We let practices automate workflows across their systems in a way that's fast, secure, and reliable. So instead of teams manually moving data between tools, Keragon makes those workflows run automatically, with Healthy staying fully up to date as the source of truth. So a large number of practices use Healthie as their core EHR, right? But as a practice, you also rely on a broader stack of tools around it. For example, patient engagement tools, communication and scheduling platforms, billing systems, ingesting data from wearables. These are just a few examples. Keragon integrates with 300 plus tools. Actually, at the right of time, we're closer to 400 now with this number, and this gives you access in a no-code way to connect all of these tools with Healthie. And the point here isn't just to replace any part of your stack. It's to make everything work together cleanly, seamlessly, so information flows in a Healthie automatically and consistently. And uh, here are a few of the most common use cases that we see on our platform across our clients today. Patient intake, for sure, is a huge one. For example, syncing appointments into calendars, sending messages in team channels or other messaging apps. Patient communication is another big one. For example, automated SMS reminders and follow-ups through tools like Spruce Health. We're going to build together such workflow today with Alejandro in a few minutes. Administrative tasks, so intake workflows, task routing or triaging, documentation system, internal alerts. You can automate wherever you can imagine. And finally, billing. For example, you can connect Healthie with systems like QuickBooks, Square, or any other tool depending on your particular setup. Before automation, this is what it used to look like, right? So a lot of manual copy pasting, resulting to human errors, delays in updating records, disconnected systems across the board, and a lot of admin work that piles up, and uh, all of this contributes to burnout. These are all necessary parts of running a quality practice. But when they're handled manually and they stack up across the day, they create a significant operational drag. So with automation, what you get is structured data synced automatically. That means fewer gaps, fewer mistakes, and hours saved every week. And all of this while you improve your patient experience. With that context today, we're going to walk through a very practical example, which is sending an automated SMS reminder through Spruce Health 48 hours before an appointment has been scheduled in Healthie. This is one of the most popular workflows among Healthie users, and it's easy to customize by appointment type or timing. So without further ado, I will hand it over now to our lead automation expert, Alejandro, who will show you how to build this live. Alejandro, you can take it from here.
Awesome. Thank you, Panos. And I'm very excited to be here talking about automation to everybody present. Before we jump into the live demo, I just want to spend a couple of minutes to actually talk about what an automation actually means and how to think about it in the context of Healthie. So what is automation? In Keragon, an automation is simply a rule that states when this happens into A, then do this automatically into B. We call this portion when this happens, that's the trigger. And the do that part is the action. In your practice, that might look like when a new patient is created in Healthie, I want them to create this in a record in QuickBooks or another tool. Or as Pando mentioned, we're going to be doing when a new appointment is scheduled in Healthie, then I want to send an SMS reminder via Spruce. So with this in mind, let's jump in and to see this in action with this quick but powerful demo that we prepared for you. Good. Awesome. So I hope that you are seeing my screen. Just say not. Yes, now I got confirmation. Amazing. So the first step is signing in into the platform. You can do so by navigating into app.keragon.com. You can create a new account with a 2-week free trial, no credit card required. I already have one obviously here, so I'm just gonna go ahead and sign in. When you sign in, this is gonna automatically redirect you to your main dashboard. And in order to create a new workflow, we're just gonna simply click on Create New. This is gonna be our helper on building this workflow. And as mentioned, the first step to any workflow and automation is picking the trigger. As discussed, our trigger is healthy. So we're gonna go ahead and search for healthy and click Next. Now we have to pick an action to execute. And as mentioned for the demo, we're gonna be using Spruce to send out an SMS message. Once we're happy with that, we're gonna click Done. Just like that, with a simple few clicks, we have a rough draft of our workflow and how it should look like. We have healthy as the trigger and Spruce health as the action. Automatically, we're gonna be able to see the options for triggers. We do support all of the events that Healthy offers, and this is gonna be via the custom webhook. But for this demo, we're gonna be using one that we have out of the box, which is before appointment starts. We're gonna go ahead and select it. We're gonna need to authenticate our account, but we have articles on this on how to authenticate all of our platforms. So I'm just gonna go ahead and select our authentication. And here, the first step for setting up the trigger, we have to determine how much time before the appointment we actually wanna send the trigger. Time before, we're gonna type in 48. And the time before in units is gonna be hours. We're gonna hit save and test with sample event. Test with sample event, what it's gonna do is allow us to feed data from Healthy into our workflow so we can set up the action step. We're gonna hit this trigger and complete it. Just like that, with a few simple clicks, we have already set up our trigger to start receiving appointments starting from Healthy. Now we can move into the action step for Spruce. Here, when we click on Spruce, we're gonna see all of our options. And what we wanna do is send an SMS. We're gonna go ahead and click Send SMS. Same procedure, we have to authenticate. We have articles and this. And here we're gonna see a prompt on all of the options that we need in order to send an SMS. We need a sender, phone number, and the message. We actually here for the phone number, we don't have the phone number since the trigger is appointment start. But here we see the powerful automation tool that Keragon is, and we can simply get this information. For this, we're gonna click on the plus button and add a new step. So now we're moving from a 2-step action step workflow to a 3-step. Add a new one, and we're gonna search patient. We're gonna use the get a patient step. And what it's gonna request from us is the patient ID. We already have this information from our trigger since we previously tested. And we're gonna find it in attendees ID. We're gonna hit select, save, and test that to configure and get real data. Perfect. Now we have feed the workflow with the appointment and the patient. Now it's time to configure the send SMS. For the sender, when we click on this, we're gonna get all the phone numbers associated to our Spruce account. Select this one. And for phone number, we can go ahead and use the search functionality by typing in phone number. Now we have the phone number from the patient. Hit select. And now it's time to type in our message. We can use something like, hi, this is a reminder. Your appointment is in 48 hours. Okay. I would say that's pretty good, but we can make it even better by customizing each SMS that we're sending by adding variables from the previous steps. In this context, we can add the first name and the last name. Perfect. We have a sandbox for Spruce for testing. I'm gonna mark this as an internal note. But for your use cases, when you have a phone number, you can just mark it as false. I'm gonna go ahead and test it and move into our sandbox. And there we got it. Now we have a internal note that says, "Hi, test patient. This is a reminder your appointment is in 48 hours." Amazing. And Keragon gives you some more options if we want to add. As an example, we can create a logic step to ensure that we have error handling in our workflow. As an example, if we wanted to only continue if sending an SMS, if the patient has a valid phone number. So we could do continue if, and to configure it, it's pretty easy. We would select the value 1, search for phone number, and we can just, the comparison, determine that it is not empty. So there is a value inside the phone number. Hit save, and just like that, we have a workflow that automatically triggers when an appointment starts, grabs the patient, checks that it has a valid phone number, and sends an SMS if it does. If we're happy with the results, we just have to click on publish. Just like that, we have a real working workflow that's ready to help you automate this process. As Manuel mentioned, this is one of our most common workflows, but we have many others, and each one varies depending on your practice. We have some templates that we're going to be sharing at the end of this webinar. One of them is Healthie to QuickBooks, which gets triggered anytime a new invoice is created in Healthie and automatically creates a new invoice in QuickBooks using all the data available. Another one that we have is getting data from Oura on a daily basis, where we can trigger it every day, grab information like daily activities, sleep, heart, blood, and more. And you don't have to use all of these options. This is very customizable, and you can remove all the data by just clicking on the trash can. The end result is creating a chart node associated to the Healthie patient's charting node. And the last example I have here is a workflow that triggers anytime a new contact is created in HubSpot. It creates a new patient in Healthie. So yeah, that concludes my demo. Next up, we have Chris, who will share his unique experience as a customer and who's going to be leveraging Keragon and Healthie for months. Stephanie, Chris, over to you.
Thank you, Alejandro. And I am certainly going to let Chris introduce himself here, but he's the co-founder and chief product officer of Harmonic Health. And Chris has been kind enough to join us today because he's been using and building real workflows between Healthie, Harmonic Health, and the tools that he uses via Keragon. So Chris, I would love for you to just share a little bit more about yourself and about the type of care that you deliver at Harmonic Health.
Yeah, absolutely. So as Stephanie mentioned, I am the co-founder as well as the chief product officer at Harmonic Health. We are a virtual tech-enabled dementia company. So we provide dementia service to patients with dementia and Alzheimer's throughout 30 different states. One of the key aspects of our program, and this is, I think, hyper relevant given some of the news over the weekend around CMMI access. I'm not sure how many of the folks on here are going to be impacted by that pretty exciting announcement that came out. We are part of a different CMMI program called Guide. So it's a relatively new program that CMS announced about a year and a half ago that delivers a per member per month payment to help better understand the cost drivers of dementia care. For those of you that don't know, the cost of providing care for dementia patients throughout the United States is really extensive. It's about 3 times the cost of your average Medicare beneficiary. And as a result of that, they're really trying to get an idea of what interventions and kind of creating a standard of care that doesn't really exist. We like to say at Harmonic that dementia is kind of maybe where like other diseases like diabetes was in the 80s or kidney disease was in the early 2000s. It's really early in trying to better deliver care. And with a lot of new medications like Leqembi, which was approved last year by the FDA, and about 100 plus other drugs in the pipeline, there's a lot more attention that's being brought towards it. So we help kind of deliver a lot of that virtual care, primarily for the patients, but also a unique use case for us is a lot of the folks that we are dealing with are caregivers. So it's going to be children, spouses, other family members who are there as a part, who are kind of joining on our calls or joining separate different calls. So we're dealing with patients as well as the caregivers, and then also dealing locally with folks, which I can get into in a little bit, which are going to be adult daycare centers, respite providers, home health services. Those are the folks, in addition to neurologists and PCPs, that we're interacting with on a daily and weekly basis.
Thank you, Chris. And I think really relevant for our audience here today is understanding when and why do we automate, right? So can you talk a little bit about some of the challenges, operational challenges or tasks that you were facing that really pushed you to say, there's got to be a better way. There's got to be a tool that can help me do some of this better.
Yeah, absolutely. So for us, with the dementia patient population, as I mentioned, there wasn't really kind of a standard of care, and getting those patients enrolled and through what we want to call like the front door of our healthcare service is incredibly high touch. So generally what our care team looks like is you're going to have, we're NP top of license. So we're going to have the nurse practitioners who are handling the screening or our quarterly management meetings, but then we have the dementia care navigators who are kind of taking the patient as well as the caregiver from the moment they either self-refer themselves over to us or a primary care physician, neurologist, or home health service refers them over to our services. They're kind of sending them over to us, and it's a pretty high touch process because you're trying to coordinate with both the patient as well as the caregiver. The caregiver usually is working a job 9 to 5. When they come home, especially if the patient is living with them, they tend to get generally really overwhelmed. And so you've got a DCN who's trying to manage 2 different people's schedules, trying to manage off hours in terms of what's taking place and the communication to make sure that we get them into our appointments, we get them screened, and we get them submitted for alignment with CMS so that they can join this program because it is a no-cost service to these patients. So there is no copay related to this, and you also get up to a $2,500 annual respite benefit as part of the service. So it's something people really want to do, but you're trying to kind of coordinate all of these different areas, and it's really high touch. You get paid a little bit more in the first 6 months as a result, but the reason for that is because you're doing a lot and you're trying to get these folks organized and you're really trying to get them into an organized care framework.
So you use Healthie as your core EHR and platform, but can you walk us through and share a little bit about what type of workflows you have started to build and those that are just like indispensable to your business today?
Yeah, absolutely. So we use Healthie as our underlying EHR as part of the requirement for CMS. And with Guide, you had to have an ONC certified EHR. For us, because we knew there were going to be a lot of unique elements of dementia, we liked Healthie because it was API first. So we use it kind of as the backbone and the backstop of what we're doing. We have a care management tool as well as a referral platform that we use to help folks track as they're going through our system for what I mentioned. But one of the key things for us is the CRM aspect is understanding what we can be doing to manage these patients in that upfront process. We're getting it from 2 very distinct channels. As I mentioned, we're getting it from referrals. We also get a lot of direct inbounds from our website. So we're dealing with kind of trying to navigate those folks through. Healthie is great because we can put them in there. We can automate out a lot of the information and the upfront like forms. We can send that out. We can deliver it. We can send a welcome packet to allow those patients and the caregivers to do it asynchronous. But as we mentioned, there's a lot going on in these people's lives. And so we try to do our best to make sure that they're not slipping through the cracks by running a nurturing campaign. And I think I saw in the chat previously, someone was mentioning that you can do SMS for appointment-based reminders. But for us, it's a lot more about like nurturing campaigns. We see oftentimes, as an example, with our self-referral, that they come in at night and on the weekends, which checks if you think about it, because it's the time that someone's at home, they're dealing with care, they might get a little bit overwhelmed, and they're looking for help and they're looking for resources. So when they come in, they're automatically creating a chart within Healthy, but then we trigger it out to Monday. So we use Monday as our CRM. The reason for that was it was cost effective with the BAA. There's also a ton of, just like we have here, there's a lot of ways to easily integrate within Monday to kind of generate off of our CRM. So we'll use that to kind of start sending out our nurturing campaigns, to send the text that what we want to do. We have different cadences based off of referral channels that people came in with. So, and depending on, did they come in, have we given them a call? We link it to our call system. It allows us to really track it. And then we can very easily send information back to Healthy once we've gotten them enrolled. So if we want to trigger forms that get sent out based off of a status that happens in the CRM, it's really effective for us. It's also highly iterative. I think is just a point that I'll keep here is with any CMMI program, you don't know a lot in your first year and you learn a lot. And the ability to have low code, easy and things to change and iterate is really, really, really beneficial because I'll get feedback from our clinical team on like, hey, this isn't working, this is, and we can go and make those changes relatively simple without introducing a ton of change management for them. That's, I think, been the real key.
What I'm hearing a lot of as well is tasks that you would otherwise manually have to do time and time and time. When you're saying high touch, right? It's client after client after client and their caregivers. And so, part of efficiency and workflows is allowing you to automate those touch points and that data or sending those handouts so that you're reducing the manual burden on your team, and improving the amount of touch points that you have with your clients as well.
Yeah, that's exactly right. And I think just on the business side of it, for us and anyone who's been a part of a PM type program, a big thing for us is staffing ratios. So when we think about what our business looks like, we are a venture-backed healthcare startup. So when we think about this, we really think about it in the lens of how many patients do we want to make sure with really, really high quality care, our dementia care navigators and our MPs are going to be able, once we're at scale, are going to be able to deliver. And so the automation around those factors is really, really key so that we meet the standard of whatever we might project in our underlying economic model.
Yeah, and of course, you want your clinicians to be able to spend time doing clinical care, right? And not administrative work and sending out reminders, appointments, handouts, education, and more touch points. So that makes a ton of sense. And then, Chris, I believe, did you have something to show us? Did you want to walk through or show some of your workflows?
Yeah, I'm happy to. Just to kind of give a summary of how this looks for folks, for us, I'll give two or three examples without going into too much so I don't expose any PII or PHI. So give me one sec. Can everyone see my screen?
Yeah, we could see it.
Awesome. So I'll just give you all an example of what our current dashboard looks like in here. So as you can see, the majority of what we're doing is going to be Monday to Healthy and Healthy to Monday. This is where a lot of the information gets sent back and forth, as well as the Healthy, both appointment creation and appointment updating. This is really key for us. So I'm going to click in here just as a quick example. What we do, because we link everything, and our uniform linking ID for everything is the Healthy ID. We call it an MRN, for everything that we do. We send that over whenever we send information from a patient's chart created within Healthy. That goes over to Monday. What we're able to do when we, for example, create a new appointment is that comes in when we are getting that appointment. I don't want to open this up. When you look in and you query that, you will get the patient ID. You can link that in there. And then as a result of how powerful Monday is, we can do lookups to very easily match it to that patient's profile. And that can also trigger the nurturing and the workflow campaigns of what we're doing. So we do it for two reasons with appointments as an example, in a very simplistic way. We do it when an appointment is created. So this actually is the appointment updating one. So when an appointment gets updated for us, what's really key is we leverage, I'm not sure if everybody does, we leverage the status of appointments in Healthy very, very heavily for occurred, rescheduled, canceled. Based off of the status of those appointments and what takes place, occurred, they're going to get pushed along, say they're in a screening process to get submitted. If that gets occurred, that triggers a workflow on Monday for our team to go ahead and do something else. If it's canceled, no-showed, or rescheduled, and we don't see a new appointment come in for a canceled or a no-show after like I think 48 hours, we run a nurturing campaign to try to make sure. We also present it to our outreach team to make sure that they're making an outbound phone call as a result of what's happening. So we have two in here. They're very unique. So it's based off of appointment creation and appointment updating, and we leverage the unique visit ID to match that. You get some duplicates, but we have a job that runs on the back end on Monday that'll dedupe that to present the most recent status related to that ID. That's I think one of the more simple things that we do within it. You can also do something that's a little bit more elaborate, and this one I just took down because I'm making some changes. But for us, one of the key things that we have discovered as we've started getting hundreds of patients as part of dementia is one of the benefits I mentioned earlier is the respite care. We don't provide the respite care. We have a ton of partners who help us provide that, whether it be home health respite or adult day center. It's based off of region, and we're in 30 different states. And we have patients across hundreds of zip codes. And respite partners have to be very specific in terms of what zip codes that they can service. I didn't want to go ahead and go crazy and build an entire respite database and like an entire tool without experimenting with what that looks like. So for us, what we did, what we're doing and what we've been experimenting with was when a patient gets approved for guide, we trigger that gets automated in our system where a value changes here. So you can see right now, just I'll quickly show this because this isn't going to have anything. Their guide status for us, when that value is approved and enrolled, that triggers, we use some of the built-in Keragon logic that actually allows us to say, like, is it this term, which I believe is approved if I click into here, to go find that item and then go to that patient. We get some information that's off of the chart and we pull that back in to our Healthie CRM. And then it runs a command that allows us, as we're looking for it, to look for a database of respite partners that we have. So we've got this is like very early non-scaling startup stuff. It's an entire list of all 40,000 or however many zip codes there are in the United States. It does a lookup of what that is, and we have a preferred partner that lives there. It then sends an email to our team that alerts them of like, hey, go find this information a respite provider has been. It also sends a team message out to the team so that they can go in, because that's like one of the key aha moments for our patients is when we're able to very quickly say, hey, we know you urgently want respite care. We found that partner. Being able to do that really quickly, communicate that both to the patient as well as to the partner is really effective because it allows them to get that scheduled a lot quicker. And this kind of just shows you all the different ways without me doing anything. This was a process all in that probably took a DCN 15 to 20 minutes per patient and now has been almost fully automated as they're looking this up. So this, I think, gives you the appointments is very simple and straightforward. This obviously is a combination of 5 different tools that we use. I will call out that we have a BAA with all of these. So we have a BAA with Microsoft, we have a BAA with Monday, obviously with Healthie, and then with Keragon as well.
Amazing. Thank you, Chris. And just to highlight a couple of things that you mentioned here too for anyone, because I have to give a shout out to Healthie also heavily uses Monday. Monday is a big part of my day-to-day life too. So if you're not familiar, it's a CRM, but also task management. So if there's any other task management tools like an Asana that you might use, so helpful. There is the Healthie built-in tasks feature, but if you ever need to bring more tasks and more specific workflows outside of Healthie, that is really what Keragon is supporting. It's allowing you to connect those workflows together. And a BAA is a business agreement. Most tools, especially for HIPAA compliance, should be able to provide you one of those so that you are ensuring your end-to-end workflows and tooling and tech stack remains HIPAA compliant. So Healthie is HIPAA compliant, ONC certified, as Chris mentioned, and Keragon is HIPAA compliant as well. Chris, maybe you want to say there is a question here, and I don't want you to give away all your secret sauce, but You mentioned nurture flows and how those work. I'm just curious if you could speak to like sort of the tools that you put together for that. Is there an email platform you use? Just to give us a little insight. I'm sure that would be useful for a lot of people.
Yeah, absolutely. So we use all Twilio products. So for email, we use SendGrid, and then for SMS, we use the Twilio
Yeah.
for that. And then in terms of like the nurturing cadence and the template, it's very much based off of our workflows of we still do. The interesting thing with dementia is uh, to very gently put it, a lot of folks are really upset with where they are with the amount of care that exists for dementia. And so we try to not go overly, especially at the beginning when we reach out to them, we try to balance a real human touch. AI is amazing and has gotten to a lot of really good place, but there's still no replacement for like a human on the other end on that initial call to build trust, especially for folks who feel like the system has kind of left them behind. And that is a majority of folks with dementia as well as their family members. That's kind of how they feel. So we use it basically after that introductory call to do some follow-up, some gentle educational information. And then we use Monday, just another, just I can't, we found it amazing. The automations that they have within there, like the ability in their CRM to set a date, send a follow-up reminder, to automate that, to drive it into a place to present it, and then to put it into visuals and dashboards. We do like a 30-minute operational excellence meeting every morning for us to review the patients that are at risk. And then there's like I'd say it's about 75% automated, 25% human to account for that. But there's a lot of things and really powerful things you can do in Monday based off of rules and dates. It's very simple for you to set up, and they have just like Keragon has like within its own ecosystem, it's got a lot of really powerful things.
Thank you, Chris. And I think that's all of our questions here. We're gonna open up for a Q&A to our general audience here. I'm gonna go through, just bear with me as I kind of go through the chat here. There are, Carolyn, you had a great question. I think it's good. And maybe Marilena, you can answer this one, but Keragon uses a lot of integrations. Do customers pay for each integration with Keragon?
Yes, definitely. Happy to take that one. So, as in the chat, the way we do is like every provider needs to have obviously an account with all the tools you're using, right? So, you already have an account with Healthy, you already have an account with Monday or any other tool on your day-to-day. On the Keragon side, you also need an account, but we do not charge based on the amount of tools that someone wants to integrate. I can maybe quickly share my screen so you can have an overview around that, but we can also send the links afterwards. We do offer multiple plans to accommodate all different sizes of providers. We go as low as 99 USD per month for usually solo practices or small private practices, and then that grows. And the differences lie on the amount of published workflows and workflow runs. So the tools are not correlated with the fees.
Thank you, Marilena. So what we, for healthy customers, and you're going to be able to access Keragon through Healthy, you will go to your integrations page, and that's where you will find the Keragon integration, but you will also find some of the sort of like shortcuts to some of the Keragon Healthy workflow integrations, like QuickBooks, like HubSpot. There are about a dozen listed in your integrations page. So you need a Healthy account and you need a Keragon account. And generally, for some of those third party, right, there's 300 plus, almost 400 tools there. You may need to have an account. Let's say, like with QuickBooks, you may also need a QuickBooks account, right? So we're connecting all of these tools together. So let's see. Let me just visit the chat again here. For the Keragon team here, if they're experiencing any issues with the platform, is there any kind of real-time support, or how does Keragon support your users?
Maybe I can take this one. So depending on the plan that you're on, you get different options for support. Like so, for the starter plan, I think there is community and ticket-based support. Moving onwards to our professional and scale-up plans, you get a way more hands-on support, even live calls to help you design workflows together. But having said that, Keragon support is not the only way to get started on Keragon. Actually, we have invested in an ecosystem of partners. They're called Keragon experts. If you head over to experts.keragon.com, you will find a number of solution partners that have been certified by Keragon, and you can contact them individually. If I'm not mistaken, one of such partners, David, is here today with us as well. So shout out to David as well. So yeah, there's a ton of ways to get support using Keragon. Like depending on your plan, from ticket to live calls, community support in our forum, or even hiring a Keragon expert to build everything and help you in every aspect of the process.
Thank you, Panos. Great question in the chat as well. Maybe I can answer this one from like a healthy customer perspective as a new solo practice. When do we think about adding on Keragon, especially when you're trying to balance the cost of tools as you're growing your practice? And so maybe I'll take this one. I would say, you need to assess where your business is at today. Where is your practice at today? And I would highly recommend listing out what are your pain points? What are those manual processes? And how much time are you spending doing those right now? So let's say you do have a tool like QuickBooks, right? How much time per month are you spending creating invoices and sending them over to QuickBooks? What are the other tools that you're using? And so for me, it always comes down to your return on investment, right? Your time is worthwhile. And so you need to start to calculate that out. And then if there is an automation there that can basically eliminate that, right? Chris mentioned there's, some workflows that are now completely automated and not manual processes anymore. That saves you time. And that time is then time you can spend seeing another client, right, in a week, right? Or doing another revenue generating task. So if you're evaluating, when is the right time to start to automate, I would really start with that list of what are you doing manually today, right? And then line that up with what could be automated and how much time would that save me? And that should give you your answer on, really how much to spend. But Chris, maybe you also have something to add on that aspect.
Yeah, I mean, this is super fresh for us. And I mean, it's a little bit annoying, but I found it to be super helpful. For us, every quarter, everyone at our company spends a week and documents what they did for that week, basically in minute chunks. And we really look and see kind of how that works and what that looks like. So our CEO does it, I do it, our MPs, our DCNs, everyone does it because we really, really look for opportunities of what generally tends to happen is like you automate something and then you introduce these new things that become more and more manual facts. And for us, what we look at is like real opportunities in terms of one, for the clinical facing staff, we look at it to go back to what you talked about earlier, which is the KPI of amount of time per week as a percent that someone's spending that's patient facing. So for us, we know generally as a business where we want that to be. And if we can figure out a way of at least introducing these sunk costs now, of putting in some at least some tech things, we know that's eventually going to scale out. And for us, we use a metric of cost of delivering care per patient as another thing for tech that helps us really understand what this looks like. It helps us better understand what our margins are as well from a business standpoint. So we kind of do a variety of those different things, both from like a cross-company exercise as well as like a business and financial perspective.
Amazing. And Marilena, thank you. In the chat, you dropped the Keragon ROI calculator, which was exactly what I was saying there. It's your time is worthwhile. You can calculate how much time you can save, no matter where you're at in practice. If you are a solo practice and you have a handful of clients, or you're a larger VC-backed startup, right? With the whole team behind you, there is room for automations, and it's just a matter of what are those pain points that you need to solve today, and how much time you want to invest into those solutions. So I just want you all to feel confident, no matter what your tech level, no matter what your practice size, automation is not something only for large organizations. There are also workflows and automations. Exactly. Automations help you scale. They really do at any level. So don't be afraid if I can learn to use Zapier and Keragon. My background's a clinician. I know all of you can as well. It just takes a little bit of time, a little bit of a learning curve there as well. One more question here. If there is not an out-of-the-box option present natively, how difficult is it to utilize webhooks? So maybe Alejandro or Pana, maybe a question for one of you.
Yeah,
Yes.
I'll take it. Okay. Let me figure it out. I think it's a great question. And it rings the bell that I should maybe have mentioned this during my initial presentation. But so working backwards, webhooks are super easy to use. If you just wrap your head around the jargon, it's a pretty straightforward concept. But in addition to that, what I would say is that we in Keragon, we have an internal connector development team that is working around the clock to fulfill any requests from our customers. So if you find that you want to use a new vendor, or maybe we have the vendor integrated, but we're missing a trigger or an action, we can take your request, and we usually have very quick turnaround times, usually less than a week to deliver this. But exactly spot on point, we have our HTTP app, which you can make HTTP calls like webhooks, or making another custom HTTP call. If you're happy to use that as well, that's awesome, and you can basically do pretty much anything with it.
I just want to add maybe something here, and maybe I can quickly share my screen because I saw some other items that can really benefit from this before we finish the Q&A. So for the question about the webhooks is pretty easy. And as Panos mentioned, if you see that we are missing a vendor, you don't have to deal with the documentation. We have a connector team where you can easily request a new vendor by just clicking here in the UI. But if it's needed and you need webhooks, we have a great documentation. And we have a help center where you can search something like webhooks. And we have a great documentation here, how to exactly use this and how to leverage it, right? Also, to expand on the Get Help, I saw that a lot. We have this Get Help section right here, where you're going to be able to cover everything from the help center on the intro, building your first workflow, intermediate step of adding logic step and helper. And if you need more customization, we have the advanced feature for loops and custom code. For workflow assistance, we have a native AI tool that can help you debug on the moment. But if needed, you can always ask our community or email our internal automation team, which has an SLA of less than a day. Currently, we are with a first response time of 2 hours. But if you need an extra helping hand and you need a automation expert to build that workflow for you, we always have the browse the partner section where you can hire an automation expert that really fits your needs and your budget.
Thank you, Alejandro. I'm just going to share for the Healthie team members, Healthie customers out there. I just want to show you where in Healthie you're going to find Keragon. So let's just take a look here. I've got an account open. If you remember, we have this little puzzle icon. This is your shortcut to your integrations page. and you will find the majority of Healthie's integrations here. You can always visit the Harbor and see our full list of partners. But as you scroll through here in the different categories, here is where you will find Keragon, and then you can click Manage. It's available for all of your plans, except for starter plans. That's our $0 a month plan. So if you'd like to use Keragon, you will need to be on our Essentials plan or above. All you will need to do is click Connect, okay, and then start your free trial with Keragon here, right? So you can follow that workflow. And then you will also see, I mentioned a few other integrations that are powered by Keragon. You will see them. Let's see if I can find the Spruce Health one here. So you'll see this. Zendesk is here, AirCall. There are quite a few which are powered by Keragon. And if you click through, you can also click and learn more about this integration. So these sort of shortcut integrations here will also tell you more. So there was certainly a lot of questions about what can this automation do. So if you click through to these, you will be able to better understand what are the actions and triggers that you can use to connect to that tool and how some of our customers are using these integrations. So certainly, you know, there's a lot of options out there. There's hundreds of tools. So starting to click through and understand, okay, this is a tool I use, and what can I do with this to either push or pull information within Healthie.
Stephanie, if I
Yeah.
may jump in here, thanks for that.
Yes.
Just to let everyone know as well, because every workflow and every use case is very different, right? So everyone can sign up for the 14-day free trial, and we do offer a free onboarding call for every user. So no matter the plan on our end, they are all entitled to this one onboarding call. So most of our users, what we've seen so far, they come with an idea or a workflow in mind, and they just leave the call with something built already. So no matter if it's a feasibility or a question around that, like everyone is entitled to that. So that maybe can help some people do the feasibilities or make decisions easier.
Thank you, Marilena. All right. I think that is the majority of our questions here.